Good morning. This is Rick Gleason and Don King. We're coming to you from the heartbeat of worker health and safety from the University of Washington, Region 10, OSHA Training Center. And Don, tell us a little bit about our special guest today.
Hi, Dr. Singh is a certified industrial hygienist. He's also has a PhD and has worked in the environmental field for many years, has traveled around the country. And what I'd like to do now is turn it over to Dr. Singh and have him give a quick bio of what he's about and what he does, and then maybe get into our topic, which is going to be manganese today.
Okay, thank you, Rich and Don, and good morning, everyone, and greetings from Kamoela, Hawaii, where I live. And what I really want to talk about today is manganese. And manganese is an element that most of us are familiar with. It is always present in steels. And if you have heard of the term stainless steel, and what makes really regular iron, stainless steel is few elements, and manganese is one of those. So it's a very useful element, and it's a grayish, wild, highly reactive metal. And I won't go into a lot of its chemistry, but one of the things I want to mention right up front is that manganese melts and boils at lower temperature than iron. So what is the significance of that for people who are, melting stainless steel, who are doing welding? That means that manganese will get airborne in preference to iron because it can boil, it can melt at lower temperatures. So that means that if we go strictly by the percentage of manganese in the steel as opposed to iron, it is very likely that a worker who is heating, melting, welding, alloys will be exposed to manganese in greater concentrations. Now, apart from welding, manganese has many uses in the industry. Manganese metal, it's in various forms, the chlorides, the oxides, manganese acetate, phosphate, manganese tetroxide, and it's also an important fuel additive. We know the term MMT, and it's also in some of the popular pesticides like Manab and Mancozeb and several others. So it's a very important materials. Now, the health effects of manganese, which are predominantly neurotoxic, have been known since 1837, when Dr. John Cooper described health problems in Scottish ore grinders, the ores that have high content of manganese. And, in 1837, Dr. Cooper described health symptoms such as the awkward walk, awkward gait, tremors, body stiffness, and so on. So it's not that we just discovered the health effects of manganese. But our current really concern is that we are finding some of those similar symptoms, to a smaller or a larger extent, among welders. I think there was a recent estimate by the American Welding Society where I saw, and I'm trying to find that information, that almost 500,000 people in the U.S. call themselves welders. And many of them are welding materials. They are welding alloys that contain significant amount of manganese. And the fact is that there may be a greater number exposed to manganese because some of those people do welding, but they do not call themselves as welders. So the exposure to people, the working population, to manganese in the U.S. is huge. Now, a typical manganese alloy steel may contain anywhere from 0.5 to 2% manganese. But some specialty steels can contain up to 12 or 13% manganese. I think if you ever come across people who are working on railroad track welding, and especially, where there is a intersection where one track crosses the other, I think if you look at from the air, it looks like frog. So it's called frog in the trade, and you can imagine that those sections of those steels may contain 12 or 13% manganese, and we can just imagine the amount of manganese that can become airborne and expose those welders. Let's look at where does another source where manganese comes from. It's not just the base alloy, it's also the fluxes, the rods. They contain a significant percentage of manganese. So there are really two sources of manganese exposure to welders. So then the question becomes that we as a hygienist or every health and safety professional, we rely on the so-called exposure limits, the PEL, the permissible exposure limit, to see what the exposure is to anyone who is involved in working with these materials. So let's talk about the OSHA PEL, the permissible exposure limit. Until now, most industrial hygienists has relied on the OSHA exposure limit to see if there's an overexposure to a worker or if the exposure is okay or under the limit. And the OSHA PEL that most of us had followed until recent time is the 5 milligrams of total welding film per cubic meter of air. Now, the problem is that the OSHA limit for measuring exposure to any kind of welding fumes, that iron oxide or manganese oxide or nickel, cobalt, chromium, is 5 milligrams per cubic meter. What does that mean? That means that if a hygienist takes a sample of air, personal air sample as to what the worker performing such task is breathing, and if the total weight, total dust, total fume on the sample is less than 5 milligrams per cubic meter, we declare it safe. And as you can see, that what makes stainless steel stainless is not just the iron. It is the presence of more toxic and more expensive metals such as nickel, cobalt, manganese, chromium, and few others. Now, those metals are far more toxic than iron. So the overall inclusive 5 milligrams per cubic meter does not really provide the industrial hygiene with a measure of whether the worker is safe with exposure to some of the individual metals. So it has really not been proven satisfactory. In fact, the ACGIH, the American Conference of Governmental Industrial Hygienists, does not use ACGIH manganese exposure, but even they withdrew it thinking that it required more study. But anyway, recognizing that the manganese is far more toxic, especially in terms of its ability to cause neurotoxicity problems, that the OSHA standard to measure, exposure to manganese is not adequate. And, well, there are many exposure limits that have been proposed, and I don't want to take a lot of time as to what the exposure limit is at this time, but the exposure limits for manganese range all the way from 0.1 milligram per cubic meter for respirable manganese by the IOM, which is the International Occupational Medicine Group, to 0.5 in UK, 0.5 milligrams in Germany, 0.3 in Japan, and so on. So what that really means is that the exposure limit for manganese should be somewhere at 0.5 milligrams per cubic meter or low, until such time that we have the ACGIH and the OSHA and there is some kind of consensus in the world as to what is safe. What is obvious to the industrial hygiene community is that it is one of the highly toxic components in the welding film, and it should be recognized and controlled as such. So now let's look at the diseases caused by manganese exposure. And for quite some time, we just called it Parkinson-like syndrome because like the regular Parkinson disease, the symptoms of exposure to manganese, or should I say overexposure to manganese, are Parkinson-like. In fact, for a long time, no one was really sure that if a person who is suffering from exposure to manganese and displaying Parkinson-like symptoms, what to call it, and we just used to call it Parkinson-like syndrome. Some people started calling it manganism, and there are terms like manganese poisoning. But the point is that really the most debilitating effects of exposure to manganese are, similar to Parkinson. They are neurotoxic. However, I just want to mention that we have knowledge now. There is a large amount of research into that in fact the medical professionals now can distinguish between regular Parkinson disease, which hundreds of thousands of people everywhere in the world are suffering from, and the special Parkinson-like syndrome, which results from exposure to manganese film. And apparently there are ways to distinguish, because the regular Parkinson disease will react to a certain type of medication, whether if it is in manganese poisoning or manganism, it apparently doesn't respond. So we are learning quite a lot. So what is really manganism? Its effects are, it is characterized by slow and clumsy gait, and some people call it cock walk, slow or slurred speech, loss of equilibrium, shakiness and tremors, decreased hand agility, mask-like face expressions, and psychological disturbances, which some have called manganese madness, and euphoria type symptoms. So you can imagine it's a pretty debilitating condition. So now, to really put it in perspective, I want to summarize by saying that workers who are involved in any activity that involves heating or melting manganese alloys, welding operations, should be aware of that our current techniques for evaluating worker exposure by using the standard total welding fume approach is not valid, because most of the total welding fume in any steel alloy is iron, whereas the exposure limit for manganese is much, much lower. For example, regular iron oxide is 10 milligram per cubic meter, and manganese exposure limits have been proposed all the way from less than 0.1 to somewhere around 0.5 or 1.0. So that means that we should look at specifically in terms of what is the exposure to manganese, not just the total welding fume. Secondly, in terms of really priorities for risk management, we should look at what is the level of manganese, even using the most stringent limits we have, because there is a relationship between the exposure and the effect. We should not panic at any measurement of manganese in the air because it's neurotoxin, because in the whole field of industrial hygiene, there is a correlation between the amount of exposure and the extent of effect. So we should always keep that in mind. Now, in terms of managing manganese exposure, I think the industrial hygiene community has a variety of ways to reduce the exposure, reduce the risk, because we have something called hierarchy of controls. And what that means is that the first thing we look at when there is exposure to a toxic substance, first thing an industrial hygienist asks is there a different material? Do we have to use this material to do the job? Well, that sometimes, we can find a material, sometimes we cannot. The other thing is that process conditions and a lot of materials. So for manganese, there are a lot of alternatives. The high manganese content comes from some of the fluxes used in the technology of welding, or there are fluxes that have lower percentage of manganese, or there are fluxes that can be melted at lower temperatures. So even if it does have higher manganese, it does not get airborne by using higher temperatures. So work practices and early medical intervention. So there are a lot of varieties. Then, of course, what we hygienists call as engineering controls, which generally involves local exhaust ventilation, but it also involves process modification. So a lot of things come under. The last thing I really want to mention is that it's just like asbestos, there is a lot of litigation appearing. Well, litigation is really not the answer, in my opinion, to control hazards and improve, health of workers. We have a lot of measures available to us and technology available to reduce the exposure. We can still use materials such as manganese. We can still use high manganese alloys if they provide safety, if they are the best material to use. What we need to do is be aware of where the risks are, what is the extent of the risks, and use our control concept, hierarchy of control to mitigate those exposures. So I hope I have been able to shed some light on this very complex and very important issue, industrial hygiene issue of today. And please ask if you have any more questions. University of Washington and many of us industrial hygienists are always available to answer anything we can. Thank you.
Boy, Jazz, that was excellent, and it was very systematically, explained. I think this is really, really excellent, and that folks can go to their, OSHA's website or their state OSHA, like in Hawaii. I know you guys have HIOSH here. We have Washington State OSHA, where they have additional information regarding safety and health. So this has been very, very helpful, and I want to thank you for that very logical explanation. And I'm going to let Dawn wrap us up today with any thoughts and words of wisdom.
One quick question, Jazz. So as far as the particulate masks that are used, just a regular mask, full mask, can be used, nothing special or specific for manganese?
I didn't really talk about masks. Don, I guess one of the things we hygienists, get kind of stuck with the idea of the hierarchy of controls and doing everything else before you put somebody in a mask. For welding, obviously, I think that's an important issue. Well, I think it's, I would say, full face mask, with the, or in some case, and there are other really technical issues, whether, under the helmet, welding helmet, where you should take samples and that kind of stuff. But, I think, any good mask that is recommended by OSHA for welding fumes would be good enough. I don't think there is any.
Well, and I understand exactly what you mean about engineering it out. What you're saying is let's exhaust all other methods, and that is our last resort. And I totally concur, Jazz. And the other thing that I think is helpful that I've seen change over the years is these smog hogs or vacuums that they now have with these welding people are really, really starting to be used more and more every day.
What are these? These vacuums are little things that you put behind the welders, or I'm not sure. What are the vacuums?
And the you had mentioned the local exhaust ventilation, and Don's mentioning the smog hogs. That's a trade name that does a great job to reduce it in the breathing zone of the workers. And more we're seeing a lot of welders with powered air purifying respirators versus just the air purifying high efficiency particulate respirators, which take a lot of work to breathe through all day. So we are seeing a lot of better personal protective equipment that's being available.
Right. I agree. I think PFPRs are big deal, and they're also, but the smog hogs, I'm still trying to think. These are also these smog hogs, the ones I've been seeing outside the U.S., and they are usually, they have a little fan, and they suck the fumes through some kind of filter, and they generally recirculate into the same air. I think, and if that's what I mean, I think those are just the most terrible things that you can, so I have to look at it. If the smog hogs are actually, if they're not ventilated outside the room, then they are doing a great damage, and I will be surprised that OSHA allows that.
Sure, and that's a very good point. So the goal is with your local exhaust ventilation to get it outside vented away from the breathing zone of the worker. if it was
Yeah, I
venting
can-
inside, to make sure that it's venting through a HEPA filter, so it's filtered
Yeah.
before it gets reintroduced back into the workplace breathing zone of the worker. So that's a very
Yes,
very good
right.
point. Absolutely.
Yeah, and I should have mentioned, because any smart hog that is not vented, ducted and vented outside the room is a good way to recirculate the same lead, expose any women, especially if they're of childbearing age, and to this highly toxic material, whether it's manganese. I'm thinking more of lead, but obviously some of the other nickel and chromium too. And I would be totally surprised that if OSHA allows that, or if anybody even asks OSHA, they can use this. I think that is because what happens is that we have checked several of them in Malaysia and some other countries. The filter that in the smog hog has a very limited capacity. So after that, in the first few days, a few hours, it may work okay. Rest of the time, it gets saturated. It doesn't have unlimited capacity. So it's recirculating the same dirty air over and over again. Like I said, it's a good democratic way to have everybody share the toxins than other.
Hey, that's a very good point. So remove it all the way outside, not into the work area.
Yeah, not in the circulation. I think the OSHA and NCG just said for years that recirculation, if you're just doing the venting, it's hot air and non-toxic, and you want to conserve energy, it's okay. But recirculating a material as toxic as manganese or lead, I think that was always a no-no.
Oh, that makes sense, Jazz. And we want to thank you so much for being with us today. I'm going to let Don wrap us up, but we sure appreciate your words of wisdom. Don?
Yeah, thank you again, Jazz, and give Mary our best. Glad that you folks are back home relaxing. It's probably about 80 degrees up there with a light breeze up in
Well, not quite. It's only 78.
Oh, okay. Well, there you go. Put on a sweater. So, I'm going to wrap up here with a quote that I think is appropriate by B.F. Skinner, and he says the environment will continue to deteriorate until pollution practices are abandoned.
Yeah, I like that. Then there would be no point.
Exactly. That's B.F. Skinner for you. So, all right.
Yeah, okay.
All right.
Well,
Okay, then.
Thanks
Thank you
again
very
for
much.
Thank you.
everything.
Yeah.
See you later.
Yeah, thank you.
Goodbye.
Yeah, thank you. Bye.
I was young and feisty, never did things by the book. Just let me get my toolbox, and I'll take myself a look. I climbed up on the dozer with my mechanic's pride. Said, you can keep it running, friend, while I poke around inside. Shake hands with danger, meet a guy you ought to know. I used to laugh at safety, now they call me Three-Finger Joe. Though I learned a lesson, I forgot it soon enough. The nicks and burns and scratches showed the young ones I was tough. Till another morning, I was grinding on some steel. My other hand got careless and fed my skin into the wheel. Shake hands with danger, step right up and say hello. Grinding wheels and metal are what made me Three-Finger Joe. I've seen mechanics burning, and I've seen them take a fall just to save themselves a minute. I've seen them lose it all. I've watched them courting trouble, seen them take a chance and lose. They get careless for a moment, spend a lifetime with the blues. Shake hands with danger. Shake hands lucky to be just Three Finger Joe.